Pacific Vein and Endovascular Center started in 2012, providing a comprehensive range of services in the diagnosis and treatment of arterial and venous diseases. Here at the center, Dr. Cheng Chin Chuan shares with us on how amputations can be prevented in diabetic patients.
Amputations is one of the most feared complications for a patient who is diabetic. A patient who is diabetic develops this high risk of limb amputation because of several factors. Namely, diabetes itself a high sugar level in the blood can actually cause the blood vessels of the leg to narrow. Diabetes affects wound healing and also affects the nerves that allow the patient to sense pain in the toes and the feet. So when you put all these three factors together, a diabetic patient can easily hurt his feet, not feel the pain, and the wound will not heal up, and there's no blood supply going to the leg. The leg eventually, the wound actually festers on and the leads will get green. And if this condition is actually not treated early, the patient can actually end up with very serious amputation problems. So my management philosophy for all my diabetic patients is that prevention is always better than cure. So if a patient is diabetic, they should actually come for annual screening to make sure that the blood vessels are actually okay. And if there are any narrowings, they should be treated early rather than late. This is an ultrasound machine. Ultrasound for the lower leg arteries is a very important screening tool in diabetic patients. Good thing about the ultrasound is that there's no use of any contrast, there's no injections, and it gives us almost up to 90% of all the information that we need to treat these patients with blocked arteries.
Hi, I'm Audrey, Dr. Cheng Chin Chuan's vascular nurse here at Pacific Vein and Endovascular Center. So angioplasty and stenting is a minimally invasive procedure where a thin plastic tube like this is inserted into the patient's artery. Okay, so through this tube, through this sheath, we can pass balloons and wires in to the area of narrowing, and then the balloon is then inflated to push the arterial plug against to the side of the wall. So sometimes a sheath may need to be inserted depending on the condition that we find inside.
Major amputations in diabetic patients can be prevented by early detection and early treatment. So over here at Pacific Vein Endovascular Center, we offer a comprehensive and multidisciplinary treatment philosophy to give patients the best care.